You hear more and more we live in this virtual world, and it's the same in dentistry. The days of having a traditional impression taken and pouring a model and going through a whole lost wax-up process of creating a crown is still pretty much how dentistry is done. But more and more we're moving more towards being able to take digital type impressions and creating crowns and inlays and onlays and things like that in a virtual world, and then utilizing milling technologies to go ahead and fabricate the restoration. At this practice we have the E4D technology, and if we just look at it, it is our ability to take an impression with this scanning device that essentially goes inside your mouth, and we take pictures of the tooth from 3 views, basically take 9 pictures, and we end up with a virtual model where we can design a crown right on this model 3-dimensionally. It allows me to control all the contours, where I want the cuss tips, and precisely how it's going to fit against the adjacent teeth. We can pick the shade, and then we put the block of porcelain in this milling chamber back here, and it mills the crown out on the spot. Now there are a lot of practices that are utilizing this where they'll create the restoration the same day, and we certainly have the ability to do that. But some of the newer porcelains are quite a bit stronger, and we like to fire in a furnace the restoration a couple of times, not only for increased strength, but to also customize the shade. So sometimes we might do a 24 or 48-hour turnaround on a restoration like this. Of course, anytime we're choosing a material for you, it's always based on a comprehensive exam and a treatment plan, and we can sit down and discuss whether this is the right restoration for you, or if a lab fabricated restoration is better. Nice thing about this facility is we also have a dental lab right next door. Bayview Dental Lab has been working, that I've been working with now for over 20 years. And so the customization of choosing the right material for what's your specific situation gives us really the best result. But having the flexibility to do chairside CAD/CAM as opposed to a lab fabricated restoration is a reality in this practice. If you have any more questions about this, feel free to give our office a call, and be happy to sit down and take a look at a consultation and figure out what's the best restoration for you.